Today we are celebrating women and celebrating National Women's Health Week, and we're celebrating it in Louisiana. So this is National Women's Health Day for us here in Louisiana.
And why is it so important?
It's so important because as women, we are the primary caregivers, and we also are the ones who make most of the decisions for our family members. It's important because we also have to take care of ourselves so that we can take care of others. Our theme this year is Healthy Women Make Healthy Communities. And in that light, what we're doing is trying to give women information that they can use, practical information that they can take home and just use that information to be a little bit healthier. Small steps, simple steps. And we're also giving them tools that they can use to make their communities better. It's not just about being a better you, but it's being a better us as a community and as a state.
What we're doing here today actually stems from some work that was done a few months ago dealing with inequality, family structure, race, and well-being in Louisiana. Today's conference and summit is about the health of women, but also the structure of family and how those things play out when we're in an environment where there's a lot of poverty, a lot of inequality, and unfortunately for Louisiana and particularly Baton Rouge, in actually one of the worst places for the health of women and families in the nation. There's a lot of reasons that that's the case. A lot of the studies that look at it, they look at wage disparity, they look at access to OBGYNs, they look at access to affordable housing, they look at educational levels, and they look at income. And those few factors are really things that Louisiana just does not score well on.
We're excited today. This particular event and agency is a partner of PICO. And so we're excited to be here with Alma and Alma Stewart, who's the CEO, and the works that highlight the health of women, the problems that we have in this state. The women of Louisiana are the last across the state in health, in employment, in salary, in truly the things that make life enjoyable. There are great difficulties in this state for women, particularly black women. And so we've partnered with the Louisiana Center for Health Equity, which is the organization sponsoring this event. We are here to represent as a voice the women we serve, the women we represent, and to bring hopefully an awareness to the women themselves of things they can do to help themselves, but more than that, a voice to our legislators, because a lot of what we see is driven by policy and law, and women feel that they are at fault when they don't have access to things in their community. That is not their fault. It is by design, I believe, of the policies that are passed in our legislature that sometimes do not give full credence and access to particularly poor women, women that don't have a voice, women that they don't have folks at the legislature, lobbying on their behalf. And so families don't always get a fair shake. So when you've got food deserts, when you've got no access for your child to get outside and play, when you don't have a grocery in your neighborhood that you can get fresh vegetables, that is not their fault. And so we're here to highlight and hopefully to bring awareness that change can come.
We as navigators are there to help people across the state understand and enroll in health coverage through the Affordable Care Act. So today I'm here to talk about the impact that the ACA has had on Louisiana and how over 186,000 people have signed up for affordable health insurance through the ACA, how Louisiana has had the highest rate of increase in enrollment of all 37 states in the federal marketplace. And so that's what we're here to talk about, is just how the law has impacted the citizens of Louisiana.
What would you like people to take away from today?
I think the most important thing to know is that insurance is available and that there are resources around the state to help people understand and navigate the healthcare website, to understand what insurance is, what copays are, what deductibles are, how that can help them, and how to find primary care doctors, It's not just signing up for the insurance, but it's once you have it, how to use it. So many people have access to the insurance that they've never had before. And there, many people are used to using an emergency room as primary care physicians. So we're here today to talk about coverage to care. Now that you have care, what do you do with it? What do you do with it? So,
I think if we can improve the lot of our children, then the health of their mothers and their families will, I think, follow that, and vice versa too. If our mothers, especially our mothers in Louisiana, can be helped to live more healthy and fulfill lives, it will be reflected in their children. But there are lots of components and pieces to that as well. And the seminar I was involved with was called the School to Prison Pipeline. So many of our children, it's not through no fault of their own, they get trapped by the criminal justice system in Louisiana. And it's not just Louisiana, around the nation, because mass incarceration is probably one of the biggest social issues and problems that we face around the United States, and Louisiana is king of incarceration. It's hard to believe, but we are. So, we, in the seminar I was involved in, the School to Prison Pipeline, we were dealing with, at least in my nonprofit, Louisiana Interchurch Conference, trying to help alleviate poverty among our children and their families in Louisiana. We're trying to do that in a number of ways, but to reach the congregations, to help them to reach out to children, to help them in education, to help mothers, to help when there's, to help the family as well, to kind of support it so that they can be nurtured and strengthened as they move forward in their lives.
I want to certainly welcome you, and it appears I've been having conversations with individuals as I came in, and just from the feedback that I've received, it appears that everyone feels that this was a good investment of your time today. Does everybody feel it was a good investment? Great. And I mean, you can't beat it for a free event either. I mean, that's wonderful. So I'm very thankful for our partners. And your presence here today certainly affirms that you agree with this year's theme, Healthy Women Make Healthy Communities. I love that theme. Every time I read it, it energizes me. It helps me to focus. And I also thought about a scripture that is very important to me in 3 John 1:2, which says that, "Beloved, I wish above all things that you may prosper and be in health, even as your soul prospers." And so, it's one thing for us to be healthy inside, but we've also got to be healthy outside, because they both go hand in hand. And so my desire is to see women who empower themselves with information, who are proactive in taking preventative measures as it relates to your health, and making sure that you continue to fulfill the goals and aspirations that you have for yourself personally, individually, and for your families as well. Women today hold the position of household managers, they're primary caregivers. Many of us are solely responsible for the health and welfare of the families in our communities as well. When we are healthy, our families are healthy. And when our families are healthy, our communities are healthy. And so I want to take this opportunity to thank you once again for your participation and your commitment by being here to improving the quality of life for yourself and for your families. What is the state of women or women's health in Louisiana? Well, we're over at the Capitol, and I saw some of you all had an opportunity to go to the Capitol and come back. And there are a lot of conversations going on at the Capitol. Budget shortfalls are certainly at the top of our agenda. Privatization of public services and decline in access to mental health care services. We have a lot of challenges. In the Center for American Progress most recent report, The State of Women in America, Louisiana ranks as the worst state in the country for women's health. I'm hoping and I'm praying that this is the last year that we'll have that ranking. You know, it's so disheartening just to even hear that. And I know you've heard it time and time again since you've been here today. This report substantiates that there is still discussion or discussions that we need to have. There are policy changes that need to take place and work that has to be done. Well, on yesterday, the Equal Pay for Women bill, Senate Bill 219 by Senator Murray, passed the Senate. That's some good news. That's some good news. The bill would ensure equal pay regardless of sex and prohibits discrimination based on sex. And though this legislation still has to go to the House committee, it still has to be, if it passes the House committee, the House floor, then it has to go to the governor for approval. It certainly makes a statement that women matter, and we deserve equity as it relates to every aspect of life, from our health care to our wages. And so my encouragement to you is to make sure as this bill travels over to the House, find out, I heard someone talk this morning about advocacy. Find out who the members of the I don't think it's going to health and welfare, but the committee where it's going to be heard, this bill, Senate Bill 219, you can find out online where the bill is going to be heard, and then you can reach out via email, phone call to the members of that committee and tell them that you support that legislation. So I encourage you to do that, if indeed you do support it. Last year, despite a concerted, unified effort across the state to enact legislation that would expand Medicaid eligibility for hundreds of thousands of our state's uninsured, the legislature did not embrace that idea. Even this year, with attempts to expand Medicaid, those attempts have been rejected. And so with that inaction, we are leaving 176,000 women in Louisiana who would have gained health insurance and access to health care with expanded Medicaid eligibility in a position of uncertainty and inequality. As I'm sure you're aware, Governor Jindal is proceeding with his plans to enter into partnerships with private entities to provide health care services to the needy, the uninsured, and the underinsured. The state-supported and LSU-operated hospital system, as we now know it, will be no more in just a relatively short period of time. So the state's oversight and all flowing involvement will no longer be in existence soon. Earlier this year, many mental health services previously provided by the state in South Louisiana have been relocated to other parts of Louisiana, with some services now provided by private operations. And so everything that's considered a private-public partnership is still questionable in terms of the outcomes for the citizens as it relates to our health care. According to the United Health Foundation's 2014 America's Health Rankings, Louisiana ranks, these rankings can be depressing when I start going over them. Louisiana ranks 44th in smoking, 45th for obesity, 45th for diabetes, and 48th overall. The major challenges that we face are high incidence of infectious diseases such as AIDS and HIV, high prevalence of low birth weight, and high rates of preventable hospitalizations. I think we can all agree that the New Orleans area, ranking 4th highest in the nation in the rate of new AIDS cases per capita, is just outright wrong. I think we can also agree that the Baton Rouge metropolitan area, ranking number 1 in the nation for new AIDS cases, is wrong. And it should not be acceptable. We should not just accept these ratings. We need to move into action. Our strengths, on the other hand, are that we have a high immunization coverage among teens. That's good. And we have small disparity in health status by educational attainment. Though we are making strides in so many areas, there is still work that we need to do. The State Department of Health and Hospitals reported this year that in the past year, children in poverty decreased by 15% from 31% to 26.5% of children. In the last 2 years, physical inactivity decreased by 10% from 33.8% to 30.3% of adults. In the past 20 years, low birth weight increased by 15% from 9.4% to 10.8% of births. Louisiana ranks 49th for low birth weight infants. In the past 2 years, drug deaths decreased by 25% from 17.1% to 12.9% deaths per 100,000 population. And lastly, since 1990, infant mortality decreased by 32% from 11.8% to 8.2% deaths per 1,000 live births. Louisiana now ranks 47th in infant mortality among states. Now, as I said a few minutes ago, these numbers can really be depressing. But what keeps me from being overpowered by the numbers is seeing your faces out there today and believing that indeed, as I saw here, you all are engaging, you are getting educated, and then you are being empowered. And so when you are empowered, empowerment dictates action on your part. How many of you all know that? Empowerment is just not for you to feel like, oh, I know this, I've got it. Empowerment means that you reach out and touch your neighbor with this information that you received today. You reach out and touch your sister. You reach out and touch your church member. You go to your sphere of influence, whether it's your fellow students, whomever it might be. You go to your sphere of influence and share this information. And guess what? Maybe you all can even come up with a plan of your own to address some of the statistics, the negative statistics that I've shared with you. You know, as Alma said, this is my last year in the Louisiana legislature, serving as the state senator from District 15 and as the president pro tem of the Senate. And as I have done every year, I wanted to be sure that the legislation that I worked on and offered this year would be impactful, that it would make a difference. And so I wanted to share with you 2 bills that I've authored this year. 2 of them address domestic violence. As you may know, Louisiana ranks in the top 5 states in number of homicides due to domestic violence. Each year, more than 5,000 Louisiana women are victims of domestic abuse. These numbers are staggering, and something needs to be done. I can tell you that my colleagues on the House and the Senate have been moving forward, even since last year, to make significant changes to reduce domestic violence through policymaking in our state. One of the bills that I have authored this year is Senate Bill 174. And if this bill is passed, it will ensure that victims of domestic violence are not wrongly evicted by landlords. The other bill that I authored related to domestic violence is Senate Bill 27, which would make sure that a domestic violence battery conviction would not be expunged from a person's record. Because people often hire others to act as caregivers for the elderly and for the children. And so I think that potential employers need to find out if these candidates for employment have been found guilty of this charge, because they are going to be the caregivers perhaps for maybe some of their own family members. So that's important information. And so when we discuss the importance of health and access to health care, we must always remember that mental health is vital to our overall well-being. And that's something we don't like to talk about a lot, is mental health. But when you talk about the holistic person, mental health is an integral part of being whole. Mental health is an integral part of being whole. And so through a Senate concurrent resolution, I have requested that the Capital Area Human Services District develop and operate a crisis stabilization unit to serve the capital region, because many of the challenges that we face in our community are dictated by mental health issues. One of the topics of discussion for today's Women's Health Rally is ending the school to prison pipeline for stronger families. You already heard that presentation, right? It was insightful for you, wasn't it? And so I have been working with the families and friends of Louisiana's incarcerated children and other advocates as well since last year to work on legislation to address this exact issue. And so this year I have authored Senate Bill 54, which would prohibit suspension and expulsion of students in grades kindergarten through 3. A report was done last year, dictated and initiated by an interim study that I did, that showed that there is an exorbitant, voluminous rate of students who are being statewide suspended and expelled from school. Now, I've gotten a lot of feedback on both sides of the issue. I know there's some teachers out here, and some teachers are very concerned about the legislation, stating to me that, you know, they've been in some challenging situations in the classroom. And I certainly salute our teachers, and I know that our teachers do a yeoman's job in the classroom. And I know too that it's not totally the responsibility of a teacher to be responsible for total discipline of a child. I believe it's an equation, and I believe that equation includes first and foremost the family, and then it includes the educational system as well. But this bill does not say that children should not suffer consequences at that age. It says that they should be kept in the school, and perhaps they should be the benefactors of some wraparound services that will help them. Because I think you would agree that keeping a child out of school, and I'm talking about kindergarten through 3rd grade, even if they have been a challenge in the classroom, we should be able to find an alternative within the school to keep them there. Now, the bill does say that if a child is a threat to the teacher or to the students, that he or she can indeed be expelled. And so, as you know, the legislative process is a very fluid one. It's always constantly moving, and amendments are taking place, bills are being adjusted. So I'm still working with opponents as well as advocates to come up with some amendments before the bill goes to Senate Finance. But indeed, that bill is directly connected to your discussion of the school to prison pipeline. Because so many times when children are at an early age and and receive a label, that label follows them throughout their school career. And so as women, I know we want the best for our children, and we want them to be offered every consideration possible to secure their success. And so in closing, let me just say this. I urge each and every one of you to become engaged in your community, and I believe you will. I want you to be engaged in what happens down at the Capitol and public policy decisions that are improving the quality of life for all of us. And that doesn't mean you have to be here physically all the time, because I recognize people have to work so that they can earn a living and, pay their bills. I get that. But you can certainly use social media, you can use the internet, and you can use the phone to access the legislators and the policymakers here. You can also learn what you can do about the important issues of the day and stay informed on news and policy developments. Volunteer and make sure that, as I heard someone say earlier, regardless of your choice for any candidate, always vote. Always vote. Always vote. That makes a difference. it makes a difference. It makes a difference. I could go on a whole nother speech on that, but I'm not going to do it. I kept having glimpses and reminiscing about the movie Selma in my mind. So, all I can say is please, please vote for the candidate of your choice in every election. Be engaged, because when you become engaged, you become empowered. And you are here today because of your commitment and dedication to making sure that our hardworking families, our neighborhoods, and our communities have the tools that they need to build a better Louisiana, a better nation, and a better world. Today, I stand with you as we work together hand in hand to make sure that Louisiana becomes a healthier state, and that we work towards having healthy women who work towards building healthy communities. Thank you all so much, and God bless you.
For someone who hasn't been to this event, what I would say is make yourself aware of the issues in your local community. Even if you're not interested in women's health, every community has value regardless of how poor it is. Every person, every population has value no matter how disparate their existence might be. So find something that you can make a difference with your community and go from there. One very obvious thing for a lot of populations that's often overlooked, particularly when we talk about health and education, is affordable housing. So look at housing patterns, think about your own housing experiences, and start there in order to make some changes.
What would you like people to take away from today?
Mostly that two things. One is we all bear our own responsibilities as well. And so if we want to be healthy, we need to do healthy things. We need to, of course, make ourselves available to what is available to us. In other words, if there are activities like this one, and others where you come and learn information, where you meet other people that you can perhaps get involved, we need to do that. We need to take a stand in our communities, number one. Number two, I'm hoping that people walk away empowered to go back home, to share the word, to share the information, to maybe look differently at their own conditions, that it may move them to action, that change comes from the bottom up. The people have to cry for change to come.
What would you like people to take away from today?
I would like people to take away from today that women have a lot of power, and that we can use that power to change the communities that we live in, that we can make our communities healthier places. And so I want them to learn how to get more involved, how to influence policy at the local level, the state level, and even at the national level. And we have an election coming up. We know that we have some issues in this state as it relates to our the healthcare system, as it relates to our communities, mass incarceration we've been talking about here, which has a significant impact on families, and especially families of color. And so if we're going to address these issues, we need women to step up, get involved, and become civically engaged in helping to shape the policies that led us here, that got us to this place, so that we can move to becoming healthier communities and healthier individuals, having thriving families and thriving communities.